Firstly, welcome everybody today and thank you for making the time. First of all, I'd really like to thank the Tech Now team for joining us here today. Secondly, I know that the invitation for today's webinar has been sent out to other UN agencies, and I can see UNODC has logged in. There should be others. So if there are many of you coming in from other UN agencies, welcome. In the chat box, say a hello. We would be in the future doing more of these innovation conversations and webinars opened up to the larger UN family. So before we start, just a little introduction in case for those of you who do not know much about the AccLab. UNDP in Pakistan since 2017 has had an innovation program. But last year, we were one of the countries selected to set up an innovation accelerator lab. We have around 60 and 30 more coming up labs all across the world at UNDP. Here at UNDP Pakistan, our Innovation-AccLab is dedicated to mainstreaming innovation into our programs and projects. We are also dedicated to finding new partners to work with us constantly. We are here largely also to hold experiments, find new ways of working and addressing the development challenges and the SDGs. As you know, that the way we have been working before has not always been successful in terms of achieving the MDGs, and now with the SDGs, which is an even more complex agenda, we need newer ways of working. We need to incorporate new partners, including private sector, startups, and young people and innovators. We need new ways of thinking that includes thinking about development issues, not from just the symptoms, but the larger system as a whole. And now with COVID, we can see the kind of complexity we are addressed with. It is working through an unknown, and innovation here is all about exploring the unknown. And we do that in collaboration with new partners. So in the meanwhile, the lab has been doing quite a lot of work. We support our country office teams, and with the country office, we've been working on future of work. We've been exploring the plastics portfolio, and most recently, we are now exploring the trends and new solutions and new ways of testing new ways of working around the COVID-19 crisis. A few months ago, UNDP supported the National Incubation Center, JAZ, and the Ministry of National Health Regulation and Ministry of Health on doing a hackathon around preventative and curative health issues. A lot of startups, and remember, this was done entirely digitally due to social distancing. And one of the winners from that online digital hackathon was Detect Now. And we really would like to introduce and plug their idea into the UN system, because they have actually come up with a super interesting idea using AI and machine learning to address the issue of testing. I'm not going to tell you how they did that, but because that's what they're going to talk about today. But testing is really critical for us, and to hear more innovative solutions around that, we thought it would be the best time right now to present it to the UN family. And so with that, just a quick introduction on the team as well. I believe they are a multinational group, a multinational team from Egypt and Germany and Greece and China and Ukraine, etc., and very passionate. And they have come up with this new idea. We have today presenting Simon Hofer, who is the project lead. I'm just going to now hand it over to Simon. So Simon, once again, thank you so much on behalf of the UN family. Also, one quick note for everyone, please feel free to ask questions. Even if you want to learn more about the technology, please ask. We're here to help answer those questions. So now over to you, Simon. Thank you so much.
Thanks a lot for inviting us. We are excited to have the opportunity to present our project to you. And I'm here today actually with Sijan, who's our machine learning expert, and with Melia, who's our medical expert. And together we've been working on Detect Now, which is an AI that detects COVID-19 from cough audio. But maybe let's start first a bit about the story, a bit of background, how it started. It was actually in March when, so I'm based in Switzerland, Zurich. The crisis, the outbreak hit us really in March, and it rapidly increased in terms of new infections. People were extremely worried. And my flatmate, for example, she had a cough, and so she was worried that she had COVID-19. She called the hospital in Switzerland and she asked, hey, can I get tested? I fear that I might have COVID. And then they asked her kind of questions to figure out if she's in a risk group. And she was not in a risk group. So they told her she cannot come to the hospital. There's not enough capacity, and she would just need to stay home. And yeah, can unfortunately not know whether she has the virus or not. And yeah, that kind of got me thinking that it's problematic that people who want to get tested cannot get tested. So there's whole capacity constraints. And if you want to get tested, then you need to travel to the hospital and actually further expose yourself to risk of infections. So there was a lot of suboptimal issues surrounded by testing. And at the same time, I remembered 3 years ago when I had a machine learning class at university, we had a project where we were detecting brain disease based on MRI scans of the brain. So to me, what was most fascinating is that we were a team of 3 students. None of us had any medical experience. And just based on the machine learning algorithms that we coded, the algorithm was able to pick up patterns on the images that the human eye could not pick up, and actually fairly accurately predict whether a patient had a certain brain disease or not. And yeah, that ever stuck with me for the time going forward. So when this crisis arrived, the idea was basically, if this works already with images, medical images to predict disease, then there's also a good chance that with audio data, we could also be able to actually predict disease. And because my flatmate was coughing, kind of the most closest idea was to just use the cough as audio data, run the algorithms through it, and then see whether we can come up with patterns. And this idea was then posted on social network, LinkedIn actually, to see if other people thought it's worth exploring. And actually the feedback was overwhelming. So we have machine learning experts, medical experts reaching out and telling us to actually work on that and participate in these hackathons. We had one in Zurich, and obviously the one that was organized also by UNDP, which then we really worked on a prototype. So that's a bit of the story around it. If we look at the problem that we're actually trying to solve here, it's the testing capacities and also in a way, the quality of tests. So currently when someone wants to do a test, the PCR, for example, the swab test, you need to travel to the place where you get tested. The tests are costly. They need to be performed by a trained clinician. And yeah, there's this whole kind of set of factors that are suboptimal in testing. So we really want to work on something that addresses all these areas, and especially also for societies that are more rural, for example, or general vulnerable societies with less access to these testing capacities. So the idea here to use artificial intelligence to detect COVID-19 just from the audio of the cough. And the beautiful thing is that every smartphone these days, they have a microphone where we speak into. So we use the microphone of the smartphone to collect that audio, and then it only needs an internet connection to basically send this audio to our servers, and then we can run it through the algorithms and basically then diagnose or give a feedback to the user how high is the likelihood of COVID-19. At this stage, I must also say already that current diagnostics, it's obviously for the medical implications, it's a medical device. We're not at a stage yet where we're allowed to give any sort of diagnostics. So currently we're at a phase where we still need to go through the clinical trials. So the diagnostic functionality, we've built it, but it's not accessible to the public. But with such a tool, the idea is really zero cost. It all runs through the smartphone, through the servers. So there's no test kits that need to be produced. It can just be used by any smartphone anywhere at any time. So no need to travel to the doctor. You could do it at midnight if you want to. You don't are bound to any opening times of testing center, for example. Now, with the team behind it, so we actually met digitally. It was a beautiful experience also for myself. It was run, as you mentioned before, entirely digital, the hackathon. So we gathered a team, very international, from Egypt, from Pakistan, from Germany, from Switzerland. None of us has met before. So it was really a team that was assembled on the go through this common mission of fighting COVID-19. And yeah, here you can see the team photo. Today in the call is Malia on the top second on the top left, and Sijan, our machine learning expert, on the bottom left, myself on the bottom right. So this photo we took with the coughing, kind of that is symbolic for what we're doing. And what was also actually a very empowering experience was that everybody you see in the picture works pro bono. So we had doctors, machine learning experts with that have their jobs at big companies or in hospitals or in startups, and but everybody was kind of bound together by this mission, and has been putting a lot of time into building the tech now. And so I think that's, for me, it was a great experience to see what the common mission can do and what passionate people can do without having met before. Now, we would also like to give you a demo, basically, of how this works. So it's also easier to visualize. This actually, I will show you illustrated, but you're free to also try it from your own phones. What you need to do is you scan the QR code. It will direct you to our website, to the testing functionality. Like I mentioned before, the testing functionality is closed from the public because we're not a medical device yet. We still need to do the trials. So that's why you need a user login and a password to access it. And it will also not give you actual diagnostics, but more like the experience, the demo experience. This is just for the legal framework that we're dealing with. But I'm now just scanning the QR code actually from my smartphone. I'm entering now the details, the credentials. In the future, this would really just be accessible directly through the website once we have the approval. So what you then see is actually the interface. I could actually temporarily stop sharing my screen. So you see the actual demo. Hopefully you see now myself again in the picture with the smartphone. So that's the interface. If you don't have it on your own phone, you can see it from here. We can click record cough. So I'll do that now. And then I will be prompted with the instructions, how we safely cough into the device. And
can you show the credentials again?
Oh, yes, of course. Yeah. Let me actually put the screen back up then. So the user is Lambda, and the password is detect now demo, all in one word. User Lambda, password detect now demo. And for those of you that are not doing it live, they can again see, my device. So we're doing this. I say, let's do it. It asks for microphone access on my phone. So we're clicking allow. We stop the recording and then we replay it. So we see the cough has been registered. We can enter some additional data points to help the algorithm actually perform even better. And then we can submit it. It will load for a bit. And then it will now get feedback from the server and comes back with a score. The score, as I mentioned before, again, just need to reiterate that you see now is purely demo purposes because actually the clinical trials have not been completed, so we cannot give actual diagnostics. But then basically for the demo, you would see, you will get a score back, a feedback with the likelihood of having the infections based on the data that we have on our server and the machine learning algorithms that then try to compare your cough to the ones of positively and negatively tested patients. Now after the demo, we would actually continue with how it works under the hood with Sijan.
Hi, I'm Zishan. I'm the technical responsible for the project. Now I will try explaining how does it work from a technical point of view. After recording the cough, we first check if the quality of the recorded data sample is good enough or not. We check signal to noise ratio. We check how many coughs are recorded using a deep learning model on edge on the user browser before even sending any data to the cloud. And if all these data verification points are matched, then we send the data to the cloud, which is shown in the big rectangle. The very first step which we perform is data cleaning. We remove all the unwanted noises. For example, if some other patient is speaking or there is a noise from the fan or any other noise, we remove it. We only keep the cough and the necessary frequencies which we want to further perform the analysis. And the first thing which we perform is we store it into a database. Our database is entirely HIPAA, GDPR, and ISO compliant. We totally anonymize the data, and some of the private information which we collect from the patient, we ask the proper consent from the user. And since we have a continuously learning approach, so all the new collected data will be used to retrain the model to further improve the accuracy of the model. But coming back after we clean the data, we then run our deep neural network, which will take the cough segment along with other biomarkers which we are collecting, like do you have lung disease or are you a smoker? We apply a statistical approach and then combining the results from statistical approach and the convolutional neural network, we give a final feedback prediction to the user. It generally take almost from 2 to 8 seconds. We have almost 3 to 4 deep neural networks in sequence. That's why it even takes up to 8 seconds on a GPU machine. And then I will try explaining some of the challenges which we faced during the technical implementation of the project. The very first challenge was we want to make it accessible and feasible for all the smartphone device. But some of the microphone MIMs, the smart chips, they have different characteristics. So and we find a sweet spot at 48 kilohertz and collecting the data at 50 kilobytes per second, and then later we convert it into 15 PCM. So this sweet spot frequency for the data collection will work for most of the devices, and it have all the information which we further require to train our algorithms. And then the second challenge was the deep neural network. They are black box. Most of the time they work. Recently they have a breakthrough performance better than humans in certain tasks, but they are totally black box. So and medical is a extremely sensitive topic. So we want to also argue why the model is making certain decisions. For that, we detected some nano patterns in the cough signal. For example, some of them are MEL spectrograms, which is a time frequency visualization for the recorded cough, or chroma and some like zero crossing features and other audio signal processing, some very nano small patterns. which a deep neural network find, they are still very complicated. And hopefully after the clinical trial, we will have a very very conclusive results. What are these nanopatterns? But we already have some nanopatterns which are quite complicated to even comprehend right now, but we're working on it. And then the third biggest challenge, we have very limited data set. We have less than 500 data samples, and for training a deep neural network, you need quite a large quantity of data. And how we solve that problem, we applied data augmentation and some other data simulations. For example, if you have a recorded cough, we tweak some of the parameters of the biosignals. For example, we changed the pitch of the recorded cough a little bit to generate some more synthetically generated data, or we shifted the signal a little bit, or added a very small white noise. From that, we were able to convert from 400 data samples to 10,000 data samples. Based on that, we have quite good initial results. And these are some of the challenges, biggest challenges which we faced during our project.
So yeah, thank you very much, Sijan. So actually, with all these challenges that we then use to solve the problems, we now have a prototype ready with very promising results. So yeah, the current, with the data that we have, we're very much convinced that we can have a strong predictive tool. We also now need actually a clinical trial, as mentioned before. So as with any medical device, they need to fulfill high standards in terms of ethical and medical, the data collection and everything around it, so that we then actually are allowed to give diagnostics. So here we're talking to different university hospitals to conduct these studies. It takes more time than we hoped it would take to actually conduct it. We had a lot of different hospitals that we talked to. Actually, the hospitals in Switzerland where we initially planned to start, now the infections, they went back drastically here, so it doesn't make that much sense to conduct it there. It would be too difficult to connect enough data. We're now looking in Greece and in Pakistan to conduct trials. So, but this is still, I would say, our biggest bottleneck. And once we overcome this bottleneck and we can show and prove under this clinical environment that it works, then we could actually deploy the device. What is also very fascinating is that actually all around the world now similar projects appeared on the radar. We saw that MIT started the project. We saw that Stanford, EPFL in Switzerland, Cambridge in the UK. They actually researching now the same area as we are. And traditionally, like researchers, they would focus on their own studies, try to publish something, and then potentially share it afterwards with other researchers. But now what we experienced is that when we reached out to these other researchers, there's actually quite a collaborative movement. People are doing this with the mission to actually bring something available to the people rather than doing it for the publications. And that really helps in knowledge sharing that we're doing currently with these other researchers. Also data collection now. We were able to collect some more data with researchers at Stanford that conducted a study in Pakistan. And so this is really a movement now that it's became global and across different universities and research teams. We're also very happy to have the opportunity to work with internationally recognized institutions like the UNDP, for example, who helped us basically ever since we first met during the hackathon from the National Incubation Center in Pakistan. But also beyond that, now we were able to participate in the Tech Protect challenge that was organized by the UNDP. And yeah, so that's also opened a lot of actually doors and helps accelerate our progress to bring it to market. In Switzerland, there's another top research institute, CERN, that is also reached out basically and also supports initiatives. So we're very happy that we get this this support from recognized institutions, because actually that's also an experience from us. We're a distributed team that met through a hackathon, and sometimes in a medical space where things are a bit more traditional, like already saying this is the team from the hackathon, like people are like, what is a hackathon? And yeah, so it's kind of hard to get these the credibility sometimes to actually say, hey, but if the UNDP or the CERN supports such an initiative, it gives a lot of weight to it, and it can actually help us accelerate a lot of the things we're trying to achieve. So now looking forward, we see that with a solution like Detect Now, we can also help beyond the initial outbreak to mitigate future outbreaks, for example. Now, especially in Europe, many countries are now dealing with how do we go back slowly to post-COVID-19, how do we open up societies, and their mass testing is still extremely relevant, because if you do these contact tracing, for example, you want to detect the people who are infected as quick as possible and isolate them to avoid future outbreaks. But also in more vulnerable and rural areas where the outbreak hit way harder, the solution has a lot of potential impact we can make. So that's why we're also trying everything we can to speed up the process and help also in the areas most affected by the virus in this very moment. Now, hopefully we get everything under control regarding COVID-19 when there are potential remedies in the future. But even then, which we hope this is happening soon, we can have an impact with such solution for future disease and maybe lay the groundwork for other audio-based detection for when people cough. We're now able to see signals in COVID-19, but also from other disease, and this could then be very relevant in that context as well. We also see synergy potential with current initiatives in telehealth, for example, where people can call a doctor and get sort of advice over the phone. I mean, such a solution could be integrated as well there, and basically the AI could then run through the conversation as well. Someone picks up the phone, they are asked to cough into their phone, and then we could also give automatic feedback basically through a phone call. But also in contact tracing, as mentioned before, many governments are starting to implement that they use certain applications that track who's been in touch with whom. Also Apple and Google, they had a large collaboration where they do Bluetooth-based this contact tracing enabling. And we see a lot of synergies actually also plugging our technology into such a solution, because for this to work the best, people need to get tested frequently. They already work with smartphones, so that's kind of a lot of synergies in that space as well. Now, with that being said, we ran through all our slides and presentation, but we're obviously happy to now then jump on the Q&A with you and answer all questions that you might have. Also, if you can feel free, we're happy to continue the conversation after this session as well. So here are our emails. You can reach out to me for project-related things, or Zishan for everything related to the product, machine learning and statistics, and Melia for medically related topics. And with that, we'll open up to the Q&A.
Thank you, Simon. And may I request you to put your emails in the chat box so then people can copy for future contact. We have a question. We have a question from Umar. Umar, would you want to unmute and ask the question?
I've typed it in the chat box.
Okay, I'll then read it out. Okay.
I'll read it out. Okay, Asan, you're doing that?
Go ahead, Tabitha.
Okay. So Umar is asking that is this based on the assumption that the COVID cough is different from a regular cough, and if there is any epidemiological evidence for this?
Very good question. So what we've been figuring that the cough itself, I mean, it's patterns within the cough. So it's very hard for the human ear to detect, or it's impossible to detect COVID-19 just from the sound of the human ear. But there are some signals that can be detected also with the human ear, for example, dry coughs and wet coughs. But what machine learning can do is actually go beyond that and also pick up on frequency and patterns that the human ear cannot pick up. And this is basically under the assumption that COVID-19, the virus, affects in a way our the way we produce sounds on a nano level, so to say. And this has been shown in other studies with asthma, for example. There's already applied audio diagnostic that recognizes in that area. So there's also the research done in other areas that are very promising. But then maybe I'll leave it up also to Zishan or Melia if you want to add something to that.
Might be Melia might have some biological explanation for it.
Hello. First, I cannot tell the machine learning experience of biosignal detecting. That's not my specialty, but for the human ear, for the medical ear, we can differentiate dry coughs and wet coughs. For the COVID-19 infection, most of the coughs are dry coughs. So I know from other studies conducted in the respiratory disease field with artificial intelligence that artificial intelligence can differentiate between dry and wet coughs. So that's like a major step. And further, we found out that we can detect biosignals in this dry cough caused from the COVID-19 infection. And they are specifically to the SARS-CoV-2 virus. I hope that answered.
Yep. And from a machine learning perspective, I can try explaining from another example, like Google recently trained a Dota 2 game algorithm, and they beat the best player in the world. And then the AI, it comes with very efficient strategies, some of the patterns, some of the strategies which we humans might not even think of. And we also believe that there are some underlying patterns which human mind or from our hearing we cannot distinguish, but the machine learning algorithm can distinguish.
Okay, thank you. Thank you for your response. I think that was, yeah, that was really comprehensive. Okay, so we have a next question from Roshana. No, sorry, this is from Rizwana. And Rizwana's question is that how long does it take for the cough recording to get back to the client? And if this analysis is made only on the basis of cough?
It takes from 2 to 8 seconds, dependent on the network bandwidth, and but we record a cough of in kilobytes, so it generally takes up from 2 to 8 seconds, and then we also take some other information, combining, for example, do you have some history of other lung diseases? Are you a smoker? What is your country of origin? Based on all that information, we apply the statistical model to calculate your risk. And from the cough, we also calculate the risk. And based on that, we make the final prediction. What is your probability for COVID-19?
Thank you. Thank you.
Okay, so our next question is, well, I think that this is, yeah, there are multiple questions. This is Maliha from UNESCO. And Malia has multiple questions. And number one, she's saying that access and openness of the app for individual and government level use would have to be figured out for reliable data. Won't there be duplication, etc.? Not sure I have articulated it correctly. Her second point is that from your data sample so far, does it show similar patterns of cough of asymptomatic carriers? That's a very, very good question. And her third point is, for countries like Pakistan with no data protection law, there would be certainly lots of ethical issues to consider. These are very good questions and comments, Malia. Thank you for asking. Simon or Zishan or anyone from the team, if you would like to answer.
Yes, so thank you very much for your comments and question. I mean, that's, you're absolutely right. It's a very sensitive area with medical data and also with working with governments. So we want to include all the stakeholders there. That's also why it's, the progress is rather rigorous. And one of the things that we mentioned with the clinical trial, there's also the ethical part in there. So when we want to use the solution and deploy it, we're going to go through the ethical committee, make sure that everything fulfills the highest standards. So that is very important to us, and obviously should be fulfilled for any medical device application. I'm not sure in terms of each points, openness for the app for individual and government level use would have to be figured out for reliable data. Or maybe can we unmute you and you could ask the question in your own words? Would that work?
Yeah, hi, thank you. So I'm just wondering, what's your impression or idea so far from your interaction with the institutes that are supporting you in terms of how are they conceiving this idea of eventually rolling it out? Because I'm just thinking if this is an app everyone can use on their phones, I mean, they can know their results and it ends there, that information. But if this is something to be used by institutes in a more systematic manner, that's different. I know this is, I mean, you don't have the answer right now probably, but just like, what's your impression from your discussion so far with the stakeholders?
Yeah, very good point. So I think for the whole rollout, we would actually think it makes a lot of sense to have a institutional partner on board who would basically roll it out. We would provide the technology solution in a way, but someone, a government or an international recognized institution helping us in the rollout, that would be the ideal scenario. What we've been realizing with conversation with many also governmental stakeholders, for example, is that they are waiting for us to come with the clinical trial results before they can get anything moving, which is understandable because, yeah, before a rollout, you obviously need to have figured out that part. But that's why, again, the bottleneck is in a way the clinical trials, the governmental stakeholders we're talking to, they're very interested. We've actually had a lot of conversations from, yeah, through the events we've been participating in that would like to help us rolling it out in their countries. But yeah, once we have the results from the clinical trials.
Okay, thanks, Simon. We have Fazila Akbar next. Fazila, would you like to unmute yourself and ask a question?
Hello, everyone. I just don't have a question at the moment, but I just wanted to know if all this information will be shared with us via email so that we can float it to our organizations.
Yes, sure. So we are recording this webinar, and along with the presentation, we will share a link with you, and then you can forward it to your organization and to your colleagues as well. Do we have any more questions? You can raise your hand and we can ask you to unmute yourself and you can ask your question.
I think Javeria has a comment. Javeria, you can unmute yourself, please.
Yeah.
Thank you. First off, thank you so much for the presentation and congratulations on this really, really smart, innovative work. So I do understand that the current idea is primarily for smartphone users. And I know that trials and testing are still in process, but I was just wondering that if in future you have any plans or do you foresee this moving toward people who have feature phones? I'm asking them this primarily because in Pakistan, we still have a large majority who is unconnected and does not have access to smartphones. So if at all you foresee some kind of a transition or inclusion for those people. And my apologies if this is a tangent.
Simon, you need to unmute yourself.
All right, yeah, I'm muted. So thank you very much for the question. Yes, correct. Currently, we've optimized it for smartphone use. But like Sishan mentioned during the presentation, we try to make sure to include, to make it work for pretty much any smartphone device. So also the lower end smartphones, not only for the top end. So to actually make it accessible to the largest amount of people that we can. Another thing we're actually looking into is like the telemedicine thing, so that even if you have not a smartphone, but you are basically calling to a certain number, we could implement the same functionality in the background. It happens anyway on our server. So we could also do it through a phone call where you would be talking to either like a chatbot in a way that says, and now please cough during 5 seconds, and then collect all the other data we need and basically give feedback then through this telehealth tool. This is something that we conceptually already planned. Implementation-wise, it's very feasible. It's basically built on the same technology, the background on a server that will be the same as for the current functionalities, but then just run through a different interface. And maybe, Zishan, you want to comment on the use of feature phones?
No, I think you communicated mostly. One of our, like you said, the direction which we are going is to provide the same support with the helpline, or with that telemedicine concept that you can call from any smartphone device and then get the result back, because in rural areas the penetration of smartphones are very low. So that could be a step to solve it.
Okay, thank you.
Thank you.
Thank you, Zishan and Simon. We have Rosanna. She has raised her hand for a question. Rosanna, you can unmute yourself and ask your question.
Yes, hello, good morning from Rome, and compliments. I'm with FAO, compliments to Detect Now for really a brilliant idea and turning into reality. My question is, how are you dealing with duplication of efforts? Because obviously there are various university labs and research centers spread all over the world that are working on something similar. Do you feel that this would actually hinder your progress or actual rollout efforts? Thank you.
Thank you very much for that question. I think it's a very very relevant one. So we see it as a huge opportunity. We don't see it as a competition at all. I mean, we're doing this really since the beginning with the intention to bring a solution available to the people and have maximized the impact we can have. So from that perspective, already the setup of the whole organization, we are not a commercially entity, we're a non-profit organized. So we thought, how can we optimize that? And it's actually through collaboration. So early on in the process, when we saw the first projects popping up at different universities, we approached them. We had several calls with them, virtual meetings, basically brainstorming, with some closer, with some a bit more less close, but overall it's been a very collaborative spirit. And we also appreciate that actually the other research universities, they are collaborative. We've been provided with inputs regarding their clinical trials, with their data collection. And in the end, machine learning works the best the more relevant data you have. So actually one thing we also addressed is that if we all would be collecting it individually, the data, then the predictive capabilities would be rather limited. But if you also collaborate in a way on the common data source that is collected, fulfilling all the standards, then we can really build even more powerful diagnostic capabilities with a common data source. So one initiative is actually now also to move towards the open access database where all the researchers then can contribute to, but also run their models through. And so yeah, overall, I think it's definitely very beneficial. We're happy that other researchers are doing very similar things.
Great, thank you. I have a question for you, Simon and team. Are you guys afraid of failing? Like, are you nervous that if this would not work? So what's your plan? Like, if this doesn't work and the COVID goes away, what would you do?
Yeah, no, I don't think we're afraid of that. We're very proud of how far we already came. In a way, we could already contribute, for example, just with the technology aspect. We have a pre-processing tool that recognizes the coughs and segments them. Like Sishan did a fantastic job in building this. It's been shared with researchers at MIT that are now using it also for their analysis. So we helped other researchers accelerate their work. We were in touch with other foundations who are doing work with audio files and segmenting them, who have been using some of the technology that was built now from our team. So I think there was already now a contribution done. So if everything would stop tomorrow, I don't think we would be, we would not say, okay, we didn't achieve anything, we came already somewhere. But obviously the goal is the huge upside is still ahead of us. So what we really want to achieve is actually a solution that is then benefiting the people, can help mitigate COVID-19. If we find remedies faster, and then our tool becomes obsolete, I think also then we're very happy in a way. This is not that we can show our solution is overcoming a crisis, but we just want to generally overcome the crisis. If there's vaccinations and other things that are more impactful, I think we would be happy about that as well. Like mentioned in the presentation, if we have now, we overcome this crisis with other solutions, then we would still leverage what we've built for other potential future outbreaks, other disease, and try to infer predictions with audio, building on what was built now over the last months within the team. So I think no matter what the outcome from now going forward is, we have a plan to make the work useful that we've been doing.
Great, thank you so much. Binish, would you go next?
Yes, thank you. Thanks so much for that super interesting presentation. So as we're slowly concluding our session with you, a question I have is in terms of kind of next steps, as the different UN agencies are listening into this, listening to this talk, and we will all be taking these ideas back into our organization and discussing it with relevant experts. What is it that, what more can we do? What is the kind of support you are looking for from the UN? And what is it, what are some key talking points for the people in this room that they should be taking back? Because I do know and I do understand, and I've seen in these years that the more than the financial aid that the UN can give, it's the branding that the UN has, which is powerful in the private sector and for startups and for new ideas. And this is where I have also seen a lot of impact that we can create. So new ventures, if they're credited by the UN in some ways or supported or endorsed, the trust factor increases by so many percentages for even impact investors, for different donors, private sector. So I know that's there, but yes, I just want to hear from you guys. What is it that, what are our key talking points?
So yeah, definitely, we're happy to use the opportunity to connect with so many smart people and relevant stakeholders from the UN. So like you mentioned, I think the credibility helps a lot. So if we can make this a collaborative effort also with the support of the UN, UNDP, this will really help accelerate, because we're talking to all these hospitals. We're now talking as a team who has the prototype, who won the hackathon. But at the same time, we're, for certain doctors who might be a bit more conservative, a bit more old school, we don't have the credibility that internationally recognized institutions have. So if you get some sort of backing through communication, through some sort of collaboration with UNDP, this would definitely add a lot of weight and accelerate the conversations we're having with these stakeholders conducting the trials. Another point is probably through the World Health Organization, which is also tied to the UN. There, obviously, we would be very happy to get involved with them and have sort of also collaborative effort. When it comes to rollout, once we have the clinical studies conducted and we want to roll it out, we're very happy to have this partner internationally recognized who can also lead the rollout. And basically, we're happy to provide them with our technology and have them help us in the rollout. Then there's this topic of UN doctors. So if there is a possibility to get UN doctors involved, I think that would also give us credibility and accelerate the progress. But then I would also leave the word maybe to Melia, our medical expert in the team.
I think you said everything. So there's not much more I can say to this, but to have someone with credibility bake this idea is something we would appreciate a lot, because as Simon said, it's hard to get through to the medical realm and convince them by just saying, oh, well, we want the hackathon. I get a lot of questions. What is a hackathon? Are you hacking something? And then I need to explain. So basically, if we would have someone who has a name known in the medical world, it would support us a lot.
And Zishan, maybe you also have anything to add here?
I have the same impression that medical, it might be one of the most difficult field to enter when it's come to AI. Like Google is a very big organization. They did cancer detection from the retinal image. But when it took them almost 1 year to just get into the clinical trial phase in last year. I think I have the same impression that having a big brand compared to we are a very small team would be very helpful for us.
Thank you so much for responding to this, Simon, Zishan, and Melia. We have one last question from Maliha from UNESCO. Maliha, would you like to unmute yourself and ask the question? And then we will close the session.
Yeah, I'm just, you know, many of us feel very low tech when we hear about AI and these digital solutions. So we're learning as we go, and AI is an area that UNESCO works on at a policy level, especially in terms of human rights and ethical considerations and building capacities. I just wanted to hear from Zishan, just generally what's going on in this sector in Pakistan, like where, I mean, do we have a lot more people learning about AI, machine learning? Do we have enough educational institutions that provide really up-to-date kind of degrees in this? I mean, just, yeah, what's the human resource pool like at the moment in this field in Pakistan?
There are some recent very good initiatives. I think there was one last year from President. It was a AI program which was conducted to train all the people to bring them into an AI space. From the curriculum perspective, I think it's very good. From like in 9 months, you become a total hands-on machine learning engineer, but there were very few limited spots. And with the new upcoming online education system, and now everything is accessible from the home. I'm also self-taught. I went to universities only for the exams, and I've seen a lot of people now learning more towards AI from Pakistan. And I've seen some startups in Pakistan which are also doing some very groundbreaking work in AI in a space, aerospace side. So in general, it's growing and it's becoming better and better.
Thank you, Zishan. Simon, if you can ask this question, if you can respond to this question by Hamza.
Just wrote it now, but yeah, I can say it now. Also here, so basically with CERN, we're having preliminary discussions about helping in our machine learning efforts. So they have world-class physical researchers, data scientists, and Zishan actually had a conversation the other week with one of their leaders in that field, and they're very also interested by the potential of this idea. And so it's still preliminary, but we're talking about in the machine learning space, yeah, getting support.
Okay, thank you so much. Thank you so much to TechNow team, Simon, Malia, and Zishan for your amazing presentation. Thank you, Ehsan, Beenish, and Javeria as well. And for everyone for joining this webinar. I hope this was informative. We will be uploading the recording and then we'll share the presentation as well. Yes, so we will send a follow-up email with the details and you can, get in touch with the TechNow team. Yeah, so thank you so much. We will now, and yeah, Ehsan, would you like to add anything to this?
No, these are wonderful people I met over the hackathon. Since then, they're doing brilliant things and going way forward and getting these brilliant partners on board, and hope you win the International UNDP Challenge as well. Fingers crossed. Thank you so much.
We are among the 20 winners now, and now we are, yeah.
Great. So we connected them to the Global Singapore Center and they've won it already. So great. This is good. So thank you so much, guys, and stay connected. Bye-bye.
Thanks so much for having us. Bye-bye.
Bye-bye. Thank you.
Bye-bye. Thank you. Thank you.
Bye.